Welcome, everyone. Thank you so much for being here. So excited to have this conversation. My name is Najma Roberts. I am an advisor with Vaccinate Your Family. And again, just welcome. Before we dig in, I have to say, while you're here, I'm going to ask everyone to please follow Vaccinate Your Family on Facebook, on all their social media platforms. Please share the website with their family and friends, and we'll post this video too. So we're asking that you like it and you share it. That's the biggest thing. I would love to introduce a sort of vaccine expert and a pediatric specialist, Dr. Nneka Holder. She's the attending physician at the Department of Pediatrics at MedStar Georgetown University and associate professor at Georgetown University. She specializes in pediatrics and adolescent medicine and is a mom of two, as I understand it. And so am I. So we can chat about being a mom of in the quarantine world later, because that's a whole it's a whole different different topic. But welcome, Dr. Holder. Thank you so much for joining us.
Thank you for having me.
Great. Well, let's just dive right in. So today, we're here to talk about vaccines with a special focus on the COVID vaccine. We want to maybe dispel a few myths. We want to get some information out there. And this conversation, while we encourage everyone to listen, is really of those parents of children that are 12 and older. We know parents, you and I are moms. Moms have lots of questions. I think my doctor probably has blocked me from her cell phone because I text her constantly like, wait, what about this one thing? And so we thought this would be a good opportunity to just get those questions out there and really be a resource for parents. Sound good?
Yes.
Great. All right, well, let's kick it off. So first, we're going to, of course, everybody's talking about COVID. We're living in a COVID world. It's on the headlines every day. So let's just kick it off, Dr. Holder. Why should kids 12 and older get vaccinated with the COVID-19 vaccine?
Is it all right if I just do a brief overview of vaccines in general and how they're approved? Because I think
would love that.
Dispel some of the mystery behind vaccines. I think as scientists, there's a lot that we do as scientists that we don't do as well of a job disseminating to the public, even though we feel like we're being open and transparent. So with any vaccine that's being developed, before it's even taken to the FDA, any company has to do their background research. And initially they start trials in animals. And then they do some very, very small trials in humans to make sure that they're safe and effective. Mm-hmm. And once they've shown to be safe and effective, then they take it to the FDA to start the licensure process. And as they increase their numbers of study participants, they have more data to present to the FDA to make sure that their product is safe and effective. And they gradually increase the numbers of study participants. And with each study participant, that brings new data, new information, more numbers to show that it's safe and effective. And then there are ongoing safety trials even after the vaccine is licensed. And then in addition to that, there's an agency called the Advisory Committee on Immunization Practices that has appointed members from the Department of Health and Human Services, as well as liaisons from the general public and from professional organizations, including one that I belong to called the Society for Adolescent Health and Medicine. There's a similar member for the American Academy of Pediatrics, the American College of Family Medicine Physicians, American Academy of College Health Physicians, American College of Obstetrics and Gynecology, Indian Health Service. All of these liaisons work closely and review details about vaccine safety and efficacy. For every single vaccine, there's a working group. So every vaccine, there's a working group that meets at different time points to determine ad nauseum the data behind each particular vaccine. The exciting thing about COVID vaccines is that for the height of the pandemic in 2020, all other research, all other scientific studies were put on hold so that people could focus on COVID. And that's how the vaccine was developed so rapidly, because all of the other stuff was put on hold and everybody focused on COVID. So it seems to the public like, oh, this vaccine was developed quite quickly. Well, that's because all the scientists worked on it all at the same time. There was the background knowledge about vaccines, but all of that seemed to be accelerated because everyone was working on it all at once. So to answer your question about why kids 12 and up should be vaccinated against COVID, now that we have, we've learned more, tremendous amount of data. Data keeps coming out every day about coronavirus since the start of the pandemic. We know that wearing masks has been shown to be safe and protective. We know that physical distancing has been shown to be safe and protective, but quite honestly, this is a virus. And so viruses mutate, viruses evolve. That's how they become stronger, and that's how they survive as a species, is they figure out ways to evade our immune system. And so every time we try to beat a virus, it mutates and becomes sort of better, stronger, faster sort of thing. So one way to combat mutations is to develop vaccines. And so the reason we would recommend vaccinating younger patients is thankfully older populations have been vaccinated against COVID-19. But again, it's a virus. So what is a virus going to do? Any self-respecting microorganism is going to figure out who to infect next. And now that most of the older population is vaccinated, the next group would be younger populations. And we have data showing that younger populations are getting infected with COVID. And in fact, they're getting infected with the mutated forms of the virus. So the virus is mutating, it's becoming more contagious, and it's affecting younger populations. So the younger populations are getting sicker and getting sicker quicker.
Wow. Well, thank you for that background, because I was going to ask, that's one of the big things everyone is saying is like, oh, how did this happen so fast? And it's a conspiracy. And what I hear you saying is, it's sort of, maybe if we use the analogy of building a house, if you have one construction worker working on building a home, it's going to take a while. But if you throw 100 folks working on that same home, you can build it in 2 days because you've got everybody sort of doing different parts of it. And it sounds like that's what the FDA did, that they knew this was a pandemic, this was, killing millions of people, or hundreds of thousands of people, and they needed to throw everything they had at it. And that's how the vaccine was able to get approved so quickly.
Actually, I like your analogy better than mine.
Well, I'm trying to convince my husband for a home remodel, so I'm all in the HGTV. And, one thing that you said too that really resonates, and I've heard others say it, is that viruses are smart. If they can't find somewhere to live, if, they're sort of, the older population is vaccinated, so they don't have a place to go, it's going to mutate and go into sort of the folks that aren't, or the younger people. And what I hear you saying is that's even why it's more important to get those that are 12 and older, so that younger population vaccinated, so virus has less places to go, less bodies to house. Is that pretty accurate?
Yes, that's very accurate. And again, we are still learning about coronaviruses, unlike some of the other things that we know about in medicine and other viruses, such as the flu virus, or even a virus called the virus that causes mononucleosis or monoinfection. There is so much we know about those viruses because we've had the time to study those viruses. We are still learning about COVID. I think at the beginning of this pandemic, we didn't think it affected kids, and we thought kids had mild disease, and we never imagined kids would need to be hospitalized. But now we are getting more and more case reports of pediatric systems being overwhelmed with younger and younger patients, even teenage patients. And we have some data also showing that those long haul symptoms that, again, we thought only affected older people. I do have a few adolescent patients in my practice who have long haul symptoms of COVID. I have one patient who is suffering from chest pain for 8 months since being diagnosed with COVID. I have another patient who is not growing
Mhm.
due to loss of appetite. Sorry, not loss of appetite, due to loss of sense of taste and smell
Okay.
from COVID. So
Yeah.
pediatric patients can get long haul symptoms from COVID,
Right.
which we
Wow.
are still trying to figure out how to manage.
Well, that brings me to my next point. We're still learning about the virus. We're still studying it. And so the question sort of that I'm hearing in parent circles is, well, if we're still studying the virus, how do we know that the vaccine is safe? And what sort of gives you and the medical community the reassurance that the vaccine is something safe, particularly that we should give our children, that 12 to 18 group, those are still our babies, and we want to make sure that what we're giving them is safe. So what's your response to that?
So yes, definitely as a parent, I want what's best for my children. I have a 12-year-old and a 14-year-old. Both of my children have been vaccinated against COVID-19. My 12-year-old particularly is not a fan of vaccines, but this is one she rolled up her sleeve and she said, Mom, let's get this over with.
Mm.
We know it's safe based on the data. Again, these vaccines have been out for now, the trials have been going on for over a year. And so we know from the preliminary data of the safety trials before it was licensed, that those study participants suffered minimal side effects that they've all recovered from. So fever, pain at the injection site, feeling ill and achy, all of those symptoms have resolved. And even when the adolescent trials were concluded, there were some initial case reports of similar side effects that we see in adults, and also some concern about heart inflammation, particularly in adolescent boys. We now have more data showing that compared to heart inflammation that you get from actual COVID disease, patients who have a side effect from the vaccine all recover, whereas patients who get COVID don't always recover.
Gotcha.
So vaccine side effects are temporary, whereas the actual effects of the disease may not go away.
Absolutely. No, it is a great point. Would you say, you have data, would you say that the patients in the clinical trials were diverse? As a woman of color, it's always important to me, like I think not with everything, but some things people of color react differently. And would you say that the studies was a diverse sample size?
So when I looked at the data, the two initial vaccines that were licensed in the United States were intentional about making sure that their sample population was diverse.
Mhm.
And I'm not promoting one over the other, so I will leave names out of it. But there was a slight lag between the two initial vaccines that were licensed in the United States, because one company was more intentional about making sure that their population was diverse. And so that's why that was literally the difference in why one vaccine got approved weeks before the other one.
Gotcha. Nope, makes complete sense. Well, let's talk a little bit about, I'm hearing on the news and on my Facebook feed and Instagram and Twitter feed, this concept of breakthrough cases. Can you explain first, what does that mean? What does a breakthrough case mean?
Thank you for bringing that up. That is really important. And again, I think one thing we're not doing well as scientists is disseminating to the public what we already know. And so there is no vaccine that's 100%.
Mhm.
What vaccines do is they make it less likely to get the disease, make it harder to transmit the disease if you do get the disease, and they make it less likely for you to suffer severe illness or complications if you get the disease.
Mhm.
The vaccine is not a cure, but it is one more strategy to fight this pandemic and to fight diseases,
Mhm.
particularly viruses. And so when we have breakthrough cases, it's expected,
Okay.
but the breakthrough cases, again, those patients tend to be less sick if than compared to patients who were to actually get the illness. I don't know if I'm making myself clear.
No, it sounds like you're saying, so breakthrough means you've gotten the vaccine and you were exposed, and now you've tested positive and maybe even showing some light symptoms of it. That person is a breakthrough case. But
Exactly.
what I hear you saying is, it doesn't mean that the vaccine just, oh, it didn't work and you're, all is lost. The vaccine is preventing ultimately death and, and severe and hospitalization for severe symptoms, being on ventilator. Is that, and I imagine that's what we're saying. The vaccine doesn't mean you may not get it. You may still feel icky, but it's still going to keep you out of the ICU in most cases. I know nothing is, 100%, but in what we're seeing in most cases, vaccinated people are not the severe COVID cases that we're seeing in the ICU.
Exactly. The cases that are being reported where hospitals and health systems are overrun with COVID patients, the outstanding majority of those patients are patients who are unvaccinated.
Okay, gotcha. No, I think that's very helpful. And again, as a mom, we went organic, so we're like, oh, I don't want to put things in my kid's body that's not safe, and if they're going to get sick anyway, then why does it matter? But we're saying it does matter. We are doing everything we can to keep them out of the ICU. They still may, if they're exposed, possibility they may test positive, possibility they may show symptoms, but we're keeping them as healthy as we can with it, even if there's exposure.
Exactly. This is one more way to target this virus that we're trying to stay ahead of the virus, right? As it gets smarter, we are trying to stay 1, 2, 3 steps ahead. We figured out that we need to wear our mask. We figured out that physical distancing and vaccines is yet another complement to our strategy towards fighting this pandemic.
Gotcha. That's super helpful. Well, I just have one other question around the COVID-19 vaccine, and then I want to get into a couple of other quick topics. So, we're all on social media, we're all seeing the news, there's misinformation everywhere. If you think about maybe in your experience as a physician, are there 2 pieces of misinformation now that you want to dispel? Like maybe we could play a game of Mythbusters. So, if you had to pick the top 2 things that you continue to hear, I'm sure your friends and your kids' parents are talking about, what are those top 2 things that you would want to, for the record, dispel right now?
So yes, what I've been hearing and the little times I dabble in social media, infertility has been a big issue with not just this vaccine, with many vaccines. And so it seems to keep popping up every few years about fertility problems in vaccines. And quite honestly, there is data showing that vaccines do not affect fertility. But it keeps coming up because it's something that's near and dear to all of us. So it's a strong argument to make, but it's an argument that doesn't hold any proof or any validity. But we do need to keep in mind that, again, being infected with a virus can affect fertility. We know this from mumps. Mumps can affect and cause inflammation of the ovaries and can cause inflammation of the testes. And so natural infection of a virus can affect fertility. Vaccines do not affect fertility. In fact, we have data showing now that if a pregnant woman gets vaccinated against COVID, she actually makes antibodies, which are the body's immune and defense system, and babies are born with protection against COVID. So the newborn is protected against COVID.
Oh, well, yeah. So what I hear you saying, just to make it plain, there is no data that shows that the COVID vaccine, or really any other FDA approved vaccine, has a direct link to infertility. But if we are so busy trying to not take these vaccines because we think it's going to cause infertility. And God forbid we get one of the viruses that has a higher potential to cause infertility, whether it's COVID or mumps or any of the other sort of viruses that are out there. Those not being protected from them there's data that shows that could cause infertility.
Exactly. One of the other myths that keeps popping up, and this is a big one, and I'm not sure where it came from, are that these vaccines somehow are implants and tracking by some larger agency or government. And that's just a myth. It's just a myth.
Yeah. I have heard that one too. And it's so funny. My 16-year-old son, who was ready to be back on the lacrosse field, so he certainly was eager to get the vaccine because that was the only way he could play. And he said, Mom, I don't know why people are worried about being tracked. I mean, advertisers track us anyway. They know what I'm looking at, what I'm ordering on Amazon, what I'm eating off DoorDash. So we're already being followed. I don't know if that makes anyone feel better, but if you're online, like the jig is up. You're technically being tracked. So I have heard that one too. And I don't, and it's hard because you don't want to make you don't want to make light of it. You know that people genuinely have these concerns, but you I'm sure as a physician that are seeing young people in the ICU and unfortunately pass away from what could have been a preventable disease, we've got to make sure we're helping people to understand that let's live by the science and live by what women of color even are saying, that are scientists, that are physicians, that are saying that is not true, but this is true, and we're trying to save lives here.
Yes, and I'll piggyback on that. They're right. Elephant in the room. We're both women of color, and medicine has not always done people of color right.
Mm-hmm.
And unfortunately, there have been major health implications going back, not just 50 years, not 100 years, even longer,
Mm-hmm.
where medicine has not been in favor of people of color.
Mm-hmm.
What's different about this vaccine is one of the key developers of one of the vaccines is a woman of color.
Mm.
She spearheaded the development of this vaccine. And that's amazing.
Mm-hmm.
And like I said, the study participants were diverse, and this vaccine is being offered to people of all ethnicities, which has not happened in this country historically.
Right.
There were treatments that were withheld.
Right.
And so this vaccine is not being withheld. It is being offered to everyone. So this is a first, and this is one of those things that makes me proud in medicine. Another thing is, medicine is not perfect. Science is evolving, and we're learning more and more every day.
Mm-hmm.
But one of the few successes as a pediatrician is vaccines.
Mm-hmm.
Hand washing,
Mm-hmm.
clean water, and vaccines.
Yes.
And I've been a physician longer than I've been a mom. My oldest child is 14. I've been a physician for over 20 years. And I can remember some of the illnesses in pediatric patients from vaccines that could have been preventable.
Mm-hmm.
And it's heartbreaking. It's heartbreaking to see someone get sick from something that could have been prevented.
Yeah. I completely agree. That is heartbreaking. And even when I was little, there are vaccines now that my kids have taken that I'm like, oh, they didn't have the chicken pox. Like I still got scars here from the chicken pox. Like, where was that chicken pox vaccine? Which brings to my next subject is, I feel like we're so COVID focused, and I, as a mom, working in public health and understanding this community, showed up to my 6-year-old's doctor's appointment. She's like, you guys are a little behind. I'm like, oh my goodness, how are we behind? She's like, you're behind on routine vaccinations. And so let's talk a little bit about that. Was this just me? And because we were like literally hunkered down in quarantine and not going anywhere. Are you seeing that, in across the country, the rates of routine vaccinations going down?
So unfortunately, right, with the pandemic, there was a significant decline in routine health visits, at least initially in this country, because we were trying to figure out, right, when things shut down, when cities took turns shutting down and health systems and doctors' offices took turns shutting down. That did lead to a drop and a delay in routine visits, which meant lots of kids fell significantly far behind in their routine immunizations.
Mm.
And so we are still playing catch up in my office. There are patients that I'm seeing that I have not seen all of last year. And I had to personally reach out to many of my patients to get them back in the office, to say that my office is safe. These are our safety practices. These are how we're decreasing risk and exposure. And it's safe to come into the office. Please come in and get your routine immunizations, because we don't need a pandemic on top of another pandemic.
Yes, that is, well, you and my kid's doctor must have had dinner together, because that's literally what she said. We don't need another pandemic on top of one, so let's get these others out the way. Absolutely. So it sounds like you're saying, to the moms, the dads, the caretakers that are listening, we want to get COVID vaccines, want to get those done for children 12 and up. We want to get everybody vaccinated, but we also need to pay attention, get our routine vaccinations up, which means going for our annual physicals. It's okay, I guess, don't be embarrassed that we may be a little behind, but go ahead and make that appointment. I know at my kid's doctor, it actually was great because we wait in the car. We call and say we've arrived, we wait in the car, or wait sort of outside, and then you go straight to the exam room. There's like not even sitting in the waiting room. So that felt good. And I know different offices are taking, different types of precautions. But sounds like that is, if there's a takeaway, it sounds like those are the two takeaways: COVID vaccine, routine immunizations. We've got to get those up.
Exactly.
Great. Well, this is super exciting. Is there anything else that you want to share that maybe I didn't cover, or anything else you're hearing, any insider knowledge you've got in the medical community, any secrets you want to share for our listeners?
I wish I could tell you that I have some secrets, but I think my colleagues in medicine have been very open. And some of my patients educate me about information as it comes. I think I don't think we've been as open as we could be about vaccine development, which I think has hurt us. And again, I think we need to work on trust. But unfortunately, I don't have any new secrets about anything coming down the pipeline.
Yeah, well, and I agree. I think, it'd be great to incorporate vaccine development as a part of, a core curriculum in schools. And so the little kids can learn about it. My 6-year-old can tell everybody how vaccines are developed. Well, there is one more question that I wanted to ask before we head out, and there is a lot of information out there. Like as I Google search, and then I get overwhelmed by all the information that's out there. Where do you tell your patients to go for trusted science-based info resources? Like where are you telling them to navigate?
So you're right. The internet is overwhelming with information, not always accurate information. So definitely sites that have accurate information are the Centers for Disease Control and Prevention, so cdc.gov. Another one is a site that's sponsored by the American Academy of Pediatrics called healthychildren.org. I think you guys have a website as well. Another one that
vaccinateyourfamily.org, just
there you go.
There.
And another one that focuses specifically on vaccines is sponsored by the Immunization Action Coalition. It's called immunize.org.
Okay. So we've got, healthychildren.org, the CDC, vaccinateyourfamily.org and immunize.org. These are some of the ones that you say you and your peers, there's trusted data, trusted information, and we can believe the information that's on these websites.
Yes.
And do you, I know a lot of times people are searching for the information on the vaccines, but also, a lot of us, we're working hard, our dollars, we're trying to stretch our dollars. Are there resources for families that may not, who are uninsured or underinsured and can't afford to pay out of pocket for vaccines? Is there resources there that you want to call out?
So definitely for children, there is a federal program. It's called Vaccine for Children, Vaccine for Children, and it's a free program sponsored by the federal government, abbreviated VFC. It's for patients between the ages of 0 to 18.
Okay.
And many pediatrician offices have vaccines allotted from the federal government, where those vaccines are reserved specifically for those patients who don't have insurance or who are underinsured, so that the families don't have to pay for those immunizations or the cost to administer those immunizations.
Mm-hmm.
If your primary care provider does not have VFC stock of vaccines, most, if not all, public health departments have VFC service, or can get you information about which offices are VFC providers.
Okay, that's great. Thank you for that. And then also for those that are listening, the vaccinateyourfamily.org also has resources on paying for vaccines, and their tools to help direct people in the right places. So we will get that, that information up there, and we also continue to update our resource as well.
There is information, you have to dig for it a little bit, but many of the pharmaceutical companies for each individual vaccine have some programs. Again, they don't advertise these very well for whatever reason, but they do have some programs where they're able to offer the vaccines at a significantly reduced rate to older patients, so patients who are unable to qualify for VFC. But you have to go to the company website, and there are specific forms and criteria that you can complete in order to get vaccinated.
Great. And the COVID-19 vaccine is free. We didn't pay for it when we got. Okay, so there's no excuse. There are no out-of-pocket dollars, whether you have insurance or you don't have insurance. Everybody that age-wise that's eligible can get the vaccine.
Correct.
Okay, great. Well, Dr. Holder, this has been lovely. Thank you so much for your time and your transparency. These conversations, as you know, they're so important. There's so many of us parents out here, moms, caretakers, that we just don't know a lot, and we're trying to understand this new world we're living in. And while vaccines aren't new, this pandemic is still very scary, and I know, still learning a lot about it, but so grateful for your time and your insight.
Thank you again for having me. It was great.
Good. Thank you so much. Well, thank you everyone for tuning in. Again, I ask that you share this video with your family, your friends, your community, retweet it, repost it on your timeline. Also visit vaccinateyourfamily.org if you have any questions, if there are any things that maybe we can, shoot Dr. Holder an email with, a couple of questions if they come from our audience. And I'm sure her and her team will be happy to continue to answer those for us. And we'll keep you updated as we learn more about not only the COVID-19 vaccine, but encouraging those to get their routine vaccinations. All right. Well, thanks again, Dr. Holder. I'll talk to you soon. Thank you so much.
Thank you.